Mrs. Gloria Smith. I'm a female in this case. 46-year-old comes with fatigue. Yes.
Hello, Mrs. Joe. I'm Dr. Vanessa, and I will be taking your history today. So, just let me help you first. So, Mrs. Joe, what brings you to the hospital today?
Oh, Doc, I'm tired.
Okay. Could you please elaborate on that?
Oh, Doc, I have been tired for the last 2 years, and this fatigue and tiredness has been so worrisome that I don't want to do any stuff. I am just always at home. I am always sleeping. I don't want to work. I just want to sleep and sleep and sleep. My husband is sick and tired of it, and he has even talked about the divorce. And because I don't feel like doing any work, I am not paying attention to the kids. I'm just fatigued and tired, sleeping, not doing any work, not taking care of the home. I have lost my job also. Now I'm not able to perform any activities also. I do not participate in kids' activities. I do not take them for the gym activities. My girl goes to Girl Scouts. I have even dropped out, from every activity, from all the social events. I have no social circle. I do not go to the parties, and it is getting so frustrated. You will not believe it, doctor. It is just crazy. I am so exhausted. I don't know what is going on, and I'm just tired. I am so exhausted and tired. My mother-in-law is always bugging me now and my husband is bugging me, and it is just crazy. And my husband is threatening to divorce, and I don't know. He's not even having sex with me, anymore. And I don't know whether he is going out. I am just getting the nightmares that I think he's going to divorce and have another woman in his life, because I'm not able to do anything. I don't know. I am just sick and tired of my life. I hate my life like anything. I'm just a sleepy Joe. I just kind of sleep. And then nighttime, I don't feel like sleeping. And nighttime, I just watch TV. And in the morning time, I just sleep. I don't know what to do, doctor. I am just so fed up with my life, and I'm very scared that my husband is going to divorce and with another woman, and I don't know what to do, doctor. I'm just so sick and tired of it. I am just exhausted and tired. I don't know what to do, doctor. I am just fed up. I'm fed up with my life, doctor. I just want to, I want to get to the bottom of it, but I don't know. Nobody's able to help me out.
Yes.
And nobody is trying to help me out. And I understand that doctors, they are good doctors, they are bad doctors. I don't know what's going on. They're not able to diagnose my problem. I don't know what is happening, and I'm not sure whom to take help. So
you need to relax. Yes, I understand. Listen, so relax.
I'm just
I'm
tired.
here to help you.
So when this happens, patient comes doctor, you stand up,
Okay.
and your hand should immediately go over
Okay.
here. So this gives you a little pause,
Yeah.
and the patient will say, "Oh, okay, you know what?"
Mm-hmm.
So remember, this is a fear
Yes.
of losing a husband.
Mm-hmm.
My amygdala is working. How will you activate those 1C receptors?
Yes.
If your hand goes over here and say, my fear will automatically touch. I told you, Dr. Linden's book, Touch, explains this phenomenon. So you have
I
to
should have gotten
up earlier.
earlier. Okay.
Yes, you have wasted so much time.
Yes.
And when you got up, I stopped talking. Okay, keep go ahead.
You need to relax, Mrs. Joe. I'm gonna do whatever is possible in my capacity. Okay. So, Mrs. Joe, Was there any incident that happened 2 years ago that would have exaggerated your feelings?
Not exactly. I just became postmenopausal at that time. My menses stopped, and after that, everything is downhill. I don't know what to do.
Okay. So, how's your relationship been with your husband before this?
Before this,
Mm-hmm.
it was fantastic. We used to have sex every night, but now it's bad.
Okay. Do you feel guilty about your feelings?
No, not exactly.
No. Have you noticed any kind of appetite change?
I'm hungry, more hungry.
Mm-hmm. Okay. Do you feel like you have noticed any kind of skin changes,
Like what, doctor?
like dryness or anything?
Not exactly.
Hair changes?
Not exactly.
Uh, so, do you feel that the need of killing yourself or harming yourself?
No.
Okay. Mrs. Joe, could you please elaborate on your menopause?
Menopause.
Menopause? What did you experience at that time? Like,
It just stopped.
It just stopped. Did you experience any kind of hot flashes? No. Would you please tell me about your kids?
One is 13,
Uh-huh.
7,
Okay.
and 5.
Okay. Did you have any complications during pregnancy?
No, not exactly.
Okay. Were there normal vaginal delivery?
No C-section.
C-section. Okay. And have you noticed similar kind of episodes before in your life?
Not exactly.
Okay. And do you notice any kind of tremors in your hands?
No.
Do you feel that you're forgetting things?
No.
Okay. Are you able to perform the daily activities?
Yeah.
Like, okay. Except that you feel low energy.
Mm.
Okay. And do you feel any episodes of increased energy or there's increased energy?
Yeah, there is I have noticed that I do not have that much energy
Mm-hmm.
like before.
Okay. You are more irritable?
Yeah, I am.
Okay. Or there is less need of you to sleep?
No, I sleep more, doctor.
Okay. Or any episodes of racing thoughts or you're not able to concentrate?
Not exactly, doctor.
Not exactly. Okay.
Why are you asking this question, doctor?
I need to actually come down to the diagnosis better and help you better. That's why I need to.
What are you thinking? I want to see your thought process. This is as a trainer, I'm asking you.
I want to rule out bipolar.
Okay. Please go ahead.
Okay. So, do you feel like having sex?
No, doctor. For the last 2 years now.
No. Have you noticed any kind of vaginal changes?
It's dry.
It's dry. Okay. And do you have any problems with your bladder?
Not exactly, doctor.
Okay. Any urinary incontinence?
Yeah.
Okay, there is. Like, could you please elaborate on that?
So when I cough and sneeze, I leak.
Okay. And do you have any problems with the bladder?
Sorry,
a bowel?
No.
Okay. Have you noticed any kind of itching in your vaginal area?
It's dry.
Like, do you have to itch? Okay. Do you have any medical problems?
Not exactly.
Okay. Any, except C-sections, have you undergone any kind of surgeries before?
No.
Okay. Mrs. Joe, do you feel safe at home?
Yeah.
You feel safe? Like, do you have undergone any kind of trauma in the past? Okay. Any kind of family history that any person in your family might have had similar symptoms?
No, doctor.
Any kind of thyroid complaints?
My mom and my sister had thyroid problems.
Okay.
Good question.
And you have noticed some kind of increased weight also.
Yeah. Do you think I have a thyroid problem, doctor?
I would have to, run some tests and examine you better so that I can reach down that diagnosis. I want to lead you on that right now. Okay. Do you have any taking any medications?
Just a doctor. I just take a small pill. It's over the counter black wash.
Okay. What's it for?
It's a hormone like estrogen replacement therapy.
Okay. And are you do you take any? I will be asking you some personal questions. So do you take any kind of tobacco?
Not exactly, doctor.
Do you take any kind of alcohol?
No.
Okay. Any kind of recreational drugs?
No.
So you got your menopause, but previously, when was your last pap smear?
Oh, last year? No, 2 years.
Okay. And have you undergone a mammogram?
Yes.
Okay, you're up to date with the mammograms? Okay. And every vaccinations? Are you up to date with your vaccinations?
Yes, flu and pneumonia vaccine I get all the time.
Okay.
The reason I get pneumonia vaccine is because I was diagnosed COPD, and now I'm not using tobacco, but previously I used to use tobacco.
Okay. So you were diagnosed with COPD.
Yes, so I forgot to tell you that. I'm sorry.
That's okay. When were you diagnosed with COPD?
Some doctor told me because I smoked quite a long,
Mm-hmm.
for 20 years now, but I don't smoke.
Okay.
I'm sorry about that. I forgot.
That's okay. So you were diagnosed for COPD 20 years ago. Okay. Then you stopped smoking.
Yes.
Okay. And are you experiencing any kind of complaints right now with cough? Any
No,
kind
now it's better.
Okay. Any kind of palpitations that your heart is racing? Okay. Do you experience any kind of panic attacks?
No.
So, Mrs. Joe,
So in COPD patients, you will ask when did you start smoking and when did you quit smoking. I've already told you that I had 20 years. So when did you start? I started at 16 and stopped at 36, something like that. You have to start an ending date.
Okay. When did you start smoking?
Now it's
Okay.
already told you that.
So, Mrs. Joe, from the history that you have given me, I can see that you're quite in distress, that you are having worries and fears about your husband leaving you since like past 2 years, and it's been a difficult time for you. And I will actually be doing some physical examination on you, and if you have other worries, you can please let me know that I might have missed. Do you have any worries?
So where are you going with the history? You should have some thought before you start examining. What are you going to examine?
Okay, I will be examining thyroid.
Mm-hmm.
I would be checking for the reflexes, and I would also see. I cannot do the genital examination.
Mm-hmm. So we will order a genital
Examination. Yes.
Not I cannot do it. You will
We
order a genital for the next visit.
Yes, and I would obviously I will be asking for hormone levels also. To rule out the reason for that, and Mrs. Joe, I will be checking. Can you please straighten? Thank you very much.
Straighten your neck. Confidence, straighten
Your neck.
Yeah.
Okay.
So one thing I would strongly advise you to,
Mm-hmm.
instead of writing 10 times, write 20 times. Because you eat sentences at the end. This is very common in patients or in the students who are coming from outside countries. Because you're thinking some question, but you're not bringing. This is not the same problem as having less knowledge. It is not tip of the tongue problem. It is your connection, your Punjabi speaking neuron is so heavily controlling your stuff. Don't worry about that. And you have to prune You have to get away that Punjabi speaking neuron and bring that English speaking neuron in. So write, I would suggest 20 times so that you can get really, really well in sentence structure formation. You can really master that. Okay, and try to open my book and write once and read 20 times. Please go ahead.
So I'm going to just see your hand.
So check your. Did you check for thyroid bruise?
With the bell. Your thyroid.
Thyroid bruise. Confidently. Okay. Your pulses in the neck.
And your pulses in the neck. Checking that. Thank you. Could you please open your mouth for me? Okay. Can you please remove your specs?
Glasses.
Okay. Just checking for any kind of signs of pallor. Okay. Can you please straighten out your hands? Just checking if you have any kind of tremor. Okay. Thank you very much. I'm going to check your pulses. I'm going to check your reflexes. Okay. Thank you. Do you have any kind of pain?
No.
Thank you. Okay. So
This, yeah.
okay. I'm checking your pulses. I'm just going to do it for the socks. Okay. Pulses of your foot, and I will be checking your ankle reflexes. Okay, thank you. Okay, right. Your reflexes seem fine, and you haven't got no tremors, or your face has no kind of scars or anything, and your hair looks fine, very well maintained. And so, Mrs. Joe, from the examination and from the history, it seems that we would be running some tests like thyroid function test and TSH levels, and we will also be running some tests of your estrogen levels and
Estrogen levels or FSH or LH?
FSH,
And LH.
FSH and LH levels, and we will also be doing some CBCs to actually check your blood count or any kind of infection if there is, and we would be performing genital exam on your next visit, and from the
Pap smear.
and pap smear
Because it was done 2 years ago.
3 years.
2 years. It was one. So you can, if the patient is sexually active, so you will confirm it and that kind of stuff.
And very well that you're up to date with your mammograms, and from the history that you've given me, it seems that you might be undergoing some depression, or it could be either due to your menopause that is leading to your mood changes. I would strongly recommend that you practice some relaxation exercises. Meanwhile, to relax yourself, that I can see that you're really irritable, and I would be there to help you out on your next visit. Do you have any questions for me?
So what are the symptoms of thyroid?
Okay, thyroid, I have to look for appetite. I have to look for any hair changes. I have to look for tremors. I have to look for irritability. I have to see the reflexes, any kind of muscle pain.
So how I remember thyroid hypothyroidism is thyroid watch.
And increased sleep.
So thyroid watch. T, tired. H, hair loss. Why are you dull, down, depressed? Down means change in menstrual cycle. R, restless legs. O, obesity. I, insomnia. D, digestive issues. Okay. Watch. W, weight gain. A, body aches. T, temperature. C, cognition. H, hypotension, dizziness, lightheadedness.
Thank you for watching the video, Enroll now in our Lean Patient Experience Certification course, link in the description below.